Hi, I'm Shannon Brinker. I'm excited today to bring to you from our side of the chairs tip of the day on behalf of my good friend Dr. Cappy Sinclair. In Dr. Sinclair's office, we actually organized his supplies, but most importantly, we color coded his supplies. And when I say that, not only the supplies that we had in the ops, but we also were able to take those procedures. And here you can see it's a Zerk tray that we kind of used. And we're going to take you through exactly what we did for him. Going in and not only looking at procedures, color coding those procedures from the cassettes to the burr blocks, to the tubs that we use. So this way we can see visually exactly what we need, and most importantly, everything is organized by that procedure. And I will tell you that one of the things that's great about utilizing the Zerk system is you will cut down on time. And so you'll see firsthand from him here in just a few minutes exactly what we did. We changed out all the cassettes, color coded those by procedures, we color coded all the tubs, and really being able now when we're doing a root canal or we're doing crown and bridge, we're maybe doing a direct composite, everything has its own color. Not only, again, just the tubs themselves, but the cassettes, the instruments have rings on them that are color coded by that procedure, burr blocks, and most importantly, everything is a complete system. And so I hope that you'll enjoy this from our side of the chair tip of the day, and most importantly, have more of that inventory supply coordination here coming soon.
So one of my biggest pet peeves as a dentist, not only now in practice, but also in dental school, was having to get up mid-procedure. There's nothing that can break the form or your confidence as a practitioner when telling the patient, wait, we have to go and get something. So with the Zerk system, what's really nice is we're actually able to have bins in every room that are replicated. So it almost eliminates and in many cases eradicates the need to even get up mid-procedure. So going into a room and sitting down, I know with confidence that we're going to have everything that we need for the procedure at hand. One of the biggest fears in dentistry for a lot of our patients is the fear of the unknown. So when they're sitting down and they're seeing that everything's assembled, everything's ready, and they can have confidence that basically we're able to do everything that they need to have done all assembled in one place at the same time. We have a pretty efficient hygiene team, or what I thought was a very efficient hygiene team, but actually with the implementation of the tubs and the trays for the hygienist, they're actually now able to set up their entire day with the tubs and trays and actually eliminate that time in between patients where they were sometimes scrambling to seat someone or were running maybe 5 minutes late. It's helped to eliminate that, which is great. So it's made our efficient team even more efficient, which has been awesome. From our assistant's perspective and my perspective as well, having everything in a centralized kind of inventory system with the tubs has really cut down on excess inventory. Having the availability of taking a quick glance around the office and see what we're maybe missing as far as supplies or things like that, we're now able to decrease our overhead and decrease our excess supplies. I'm happy with that because it helps me save on overhead. So in my experience, the tub system really kind of helps you cut down on some exchange times between patients. So I would say on average, it helps, there's about 5 minutes of setup per day and about 5 minutes to breakdown in between patients per hour. So I would say the Zerk system helps save us about 3 to 5 minutes per hour, which doesn't sound like too much. However, when you multiply that throughout an 8-hour day, you're looking at about somewhere between 35 to 45 minutes. Multiply that by a week, and you're starting to really gain some valuable time that you could be either doing other types of production, adding new procedures to your practice, and really generating more revenue.